Hey, good morning and welcome again to the next edition of the Virtual Run videocast series. We're here with Dr. Jason Dapore, team physician for the Columbus Blue Jackets, and I'm Ben Bring, the medical director for the Capital City Half and Quarter Marathon sponsored by OhioHealth. So Dr. Dapore, thanks so much for coming today. For our content expert today, we were going to go over a couple of strategies and things to keep your lower extremity nice and mobile, if you will. I know we always talk about working on calf stretching and things like that. So just kind of looking at the hip, what are some good hip mobility things that we can look at for runners, especially looking at the lower chain, the kinetic chain, and the lower extremities there?
Thanks for the opportunity to be a part of this. So, we see athletes of all ages, shapes, and sizes, runners, hockey players. And I think what I see largely in my practice with the lower extremity, how it impacts runners, is I think a lot of our patients underestimate the impact of the day job on their running performance. Very few of us are professional athletes where they can spend their whole working careers on their craft and their sport. And so a lot of us are working 40 to 60 hours a week. You and I are seeing patients, teaching. A lot of our patients are now home, sitting down on Zoom calls. So that impact of that 40 to 60 hours at the desk has a big impact on your hip mobility, your knee mobility. And largely what I see in my practice where we try to impact our patients is strengthening the hamstrings and hip mobility. So we oftentimes lay out a variety of different exercises that they can incorporate on a day-to-day basis to help their running.
Yeah, and I know you're really big on strength training too, especially to be a good, strong runner. What are some of your favorite ways of doing strength training? Maybe someone at home may not have access to their gym right now due to the pandemic. Some good things maybe you can do at home to help build some of the strength back up in addition to some of those mobility techniques.
Well, I think probably one of the foundational exercises for runners and athletes would be the squat. And we always kind of test the squat mechanics in our clinic. We work with excellent athletic trainers and physical therapists. So we just kind of see, can our patients execute a very sound, body weight air squat? And if they can't, then that's an immediate area where we can have an impact that's also reproducible to watch their progression. So if they can't execute a good air squat where the shins are vertical and the hip crease is below the tops of the knees with good sound form and upright technique, then guess what? We've got to work on some hamstring strengthening. We got to pull apart the squat and see how we can get some foundational exercises in there. So maybe some banded hamstring curls. Maybe we start with a box squat. Raising it up a little bit, get them some success where they can get 50 at a little bit of an elevated height, and drop the height and make sure that the form is good throughout.
Yeah, that's great. I know one of the things you taught me as a fellow, I remember, was stacking books up on a chair to kind of help with that if you don't have access to boxes. So you talked about a little bit of hamstring weakness. What are some other muscles that tend to get weak, from sitting all day? Or, we always call it kind of like that dead butt syndrome of just spending so much time at the desk. What are some other muscles we can look at targeting? Yeah,
so I think that I always impart to the patients that, like we taught you when we do an exam, if you examine bicep or tricep strength, the muscle doesn't spasm. When we lay an athlete down, if their hamstring spasms, for some reason, we kind of accept that, but that is a sign of weakness, and so the hamstrings and the glute max should be the most powerful muscles in our body. And so what you want to do is you want to make sure that they are exactly that, because if an athlete comes in and says, I've always had tight hamstrings, to me that tells me I've always had weak hamstrings. So with them being so powerful, you can't possibly lengthen them by stretching. You've got to add load. So that's where the squatting, adding some things like good mornings, Romanian deadlifts, really try to lengthen those hamstrings safely in the controlled gym environment under load will really help build those power muscles back up. That'll hit the glute max as well. And then as they get into their 50s and 60s, if they've always been running on tight hamstrings, as we see oftentimes, they start to break down those glute med tendons. They start to get that runner's butt. And so really the foundation is having a real strong, powerful stride. And I feel that begins with strong hamstrings and glute muscles.
Yeah, that's great. And what are some other really good online resources you'd recommend too? Maybe places to look for, learn how to do some of those RDLs or good mornings, things like that. I know one of your favorite exercises is the overhead squat too, which I know takes a little bit of time to learn. Probably one of the best indicators of flexibility, strength, core strength, etc.
Yeah, absolutely. That we've been talking a lot about the hips down, but what the overhead squat shows is some of that trunk mobility, that thoracic mobility. Sitting on our Zooms, sitting in our laptops. So that really, if your mid back gets stiff and loses rotation, that you lose a lot of springing as a runner. You start to get neck pain if you start to go overhead. So that overhead squat really tests the coordination, to your point, of the hips, the core, and the mid back mobility.
Yeah.
So as far as online resources, just kind of, I recommend, people resonate with different teachers. Start with your an excellent physical therapist, start with an excellent strength coach, start with an excellent sports medicine physician that can instruct you locally, and then you kind of take that and look online. I like Kelly Starrett, the Supple Leopard. I like Jill Miller of the Role Model fame. All of them have. There's also the prehab guys in California. A lot of our own OhioHealth physical therapists and athletic trainers. We have a lot of online resources locally as well. So I think kind of seeing who you resonate with, who you connect with, and who you're improving with is really the team that you should assemble around yourself.
Yeah, and I think you brought up a really good point too. I know whenever we go to the gym, you see everybody doing the push exercises. And I know you were always really big on pulling and scapular retractors and really building up those muscles in the back. If you could touch on and talk about how those muscles are important too for runners, to help build that core strength, and also, we tend to get that forward slouching position while we work, at a desk all day. So what are some of your favorite, maybe rows, bent over rows, resistance bands, things like that?
Well, yeah, some of the very easy things to. So what you're talking about is, the power lifts, the squat, the deadlift, and the bench. They all have, they're the good test lists, but they're just a component. You're only going to be as strong as your lat strength is on your bench. So hitting those areas of weakness, which we often see, from the position, from our desk positions, you push a lot, but if you don't have a good anchor in the back, so we love rows, we love banded pull-aparts, we love face pulls. Anything to test the rhomboids, pull-ups, lat pull-downs. There's so many things that I think everybody's kind of recovered from the pandemic gym shutdown, and so everybody's got things online now to purchase. So, purchasing bands, purchasing kettlebells, purchasing dumbbells, and then just kind of incorporating. If you're real busy and you've got just so much time to run, in your home or you're between Zoom calls, do like 4 sets of 30 banded pull-aparts. Kind of incorporate activities throughout your day to fight against what that desk is doing to you.
Yeah, for sure. I know I've run into this too. 3 or 4 hours of Zoom calls back to back. I've actually got a kettlebell in my office. I think hopefully you'd be proud of me there. Dr. Dapore, is one of my teachers and mentors as a fellow. Taught me everything I know about sports medicine and life and beyond. So, So any other final thoughts or things for strengthening or mobility, or any other thoughts for runners out there that may help them get through the next, the next few months of cold weather?
Yeah, I think it's very important to, when we talk about distance with running, once you get to the half marathon or the full marathons, I always say, you kind of jumped into professional grade running. So treat yourself like a pro athlete. Spend time for active recovery. Spend time scheduling an off season where you're going to take kind of a mental break. You're going to maintain your cardiovascular fitness, but don't overemphasize cardiovascular fitness at the strength of your strength or at the detriment of your strength, mobility, and overall musculoskeletal fitness. So find times, kind of portion out your year where you're going to be training, performing, and then also times for recovery, and get it, because you're running professional grade distances, get a professional team around you, people that can help you with your mobility, help you recover, and help keep you in optimal running and strength shape.
Yeah, great. So, if you ever do need that professional, Dr. Dapore is here, and his team can help you guys get back, if you do have injuries or things like that you need to recover from. So, Dr. Dapore, thanks so much for coming on today, our content expert for today, and we'll look forward to seeing you guys on the next the Virtual Run podcast videocast series.